Hello, my name is Shramila Ital. I'm a breast medical oncologist practicing at Alliance Cancer Center, a part of US Oncology in Philadelphia, United States. Thank you for inviting me to talk about this very important topic. And the main focus is on wellness in women's health. We have seen such amazing progress in the past few years in treating women with breast cancer and closing the gap between treating and cure. How about we work a little bit harder in prevention and early detection in breast cancer? So in the next few minutes, we shall talk about a few facts and measures to take for prevention. So breast cancer awareness is the key component of early detection efforts. So as you see, the statistics here are staggering. 60% of breast cancers are diagnosed at advanced stage in India, and almost 1 in 3,000 pregnant or nursing mothers will have breast cancer. So it affects the young and the old. And then COVID-19 pandemic resulted in unprecedented changes and challenges to the care of women with breast cancer. So as anticipated, delays have occurred in screening for breast cancer that has led to decline in the detection in all age groups. So we are expecting mortality from breast cancer to rise in the next decade or so. For example, in United States, it's already expected that there will be a 1% increase or at least 10,000 additional deaths in the next 10 years from breast cancer alone. So about some statistics about breast cancer in United States, roughly about 280,000 new cases of breast cancer will be diagnosed in 2021. And 1 in 8 women in their lifetime will have a chance of being diagnosed with breast cancer. Although the rates were previously declining, we are anticipating a slight increment in the rates. And as you could see earlier, the stage at which it is diagnosed, their chances of living longer being free from breast cancer is higher. Now, if you were to look at the statistics amongst women who get breast cancer, it is leading in United States. 30% of them do get breast cancer, and almost 50% comprises between breast, lung, and colon cancer. So that's really a staggering number once again. Now, there is a huge benefit in early detection, which is the best protection. So regular mammograms have shown to save lives, and so far is the best tool for finding breast cancer early. When we detect cancer at an early stage, majority of women remain free from their cancer in the long run. And mammogram is a low-dose X-ray of the breast, and it does not have a chance of triggering cancer in healthy cells. In fact, it can find cancer even before a woman could feel a lump in their breast. The guidelines, at least in the United States, for screening for breast cancer have many agencies have different guidelines. The most common that is followed is to begin with mammogram at age 45. Between 40 and 45, one has a chance to discuss with their doctor about getting mammogram. And beginning age 55, it may be transitioned to every other year. You would continue to do mammograms as long as one remains in good health and has an expected lifespan of more than 10 years or so. Keep in mind, this screening is meant for women who have average risk. On the other hand, women who do have high risk for breast cancer, such as having a personal history or a family history or any other risk factors, they should be screened much more vigorously besides doing a mammogram, in addition doing MRI of the breast at much younger age as well. How is mammogram going to help with breast cancer? So if we were to do 1,000 mammogram, it may detect cancer in 5 out of those 1,000 women. So if you were to break down, 100 of the 1,000 women will be asked to come for additional pictures of mammogram ultrasound. 61 of those 1,000 will have additional pictures and nothing will be found. 20 of those will be asked to come back for 6-month follow-up with additional imaging, but no further intervention. 19 of those will be asked to do a biopsy, and only 5 of those get diagnosed with breast cancer. So mammograms do save lives. So if you could see here, the size that one has to find themselves in the breast has to be much larger as compared to what mammogram can pick up breast cancer. And this is how it appears on a mammogram. These are referred to as microcalcifications. They may be tube-like, or they may be branching, or they may be spot-like, and it is magnified many-fold. And if biopsy, this leads to diagnosis of early stage breast cancer, even before one could find a lump in their breast. There is a difference between early detection versus early screening. Early detection refers to when a woman presents with signs and symptoms that they find in their breast and bring it to the attention of their doctor. And by early detection, yes, it does improve health and their quality of life and lowers the cost of care. Whereas when you're screening, you're targeting across a at-risk population, and this is a large number of people involved. And it is shown to improve survival rates when it is targeted at large population, and it has a population-based impact. Now, is mammogram the only method of screening? Yes, by far today, until today, mammogram has been shown to be the only effective screening test to detect breast cancer. There are some new imaging techniques that are becoming available and experimental stage. Of these mentioned here, it's only contrast enhanced mammography that's become available in the United States, which uses contrast iodine and takes pictures, which is proving to be less expensive than an MRI of the breast. And none of these are used for screening methods. If on initial screening you find something abnormal, that's when you want to use these additional methods. The last test, the electrical impedance imaging, that's the only test which does not emit radiation, and it is based on the idea that breast cells will conduct electricity, which is different from normal cells, and pick up some abnormal areas. That's the idea with the newer breast imaging. So more to come, and please stay tuned about that. Now, there are risk factors that causes breast cancer. There are risk factors that one cannot change, and that is being a woman, of course, and also getting older. There's also risk factor that cannot change, which is inheriting certain genes, such as BRCA genes 1 and 2. Previously, we only knew about BRCA 1 and 2 as hereditary genes, but now we know about 30 additional hereditary genes, and if present, one has a high risk of getting breast cancer. Now, BRCA genes are those, in general, BRCA genes makes proteins that will repair damaged DNA. Supposing BRCA gene itself is mutated, it cannot repair the damaged DNA, and that leads to abnormal cell growth and cause cancer. Also, having a family history of breast cancer is something that you can't change and adds to the risk of getting breast cancer. What is listed here, all these risk factors, are telling us about their relative risk of getting breast cancer if one carries this risk factor. But there are risk factors that one can change, such as you avoiding use of alcohol or having early childbirth. So in fact, it is shown that if one were to drink alcohol 1 glass every single day, it increases the risk of getting breast cancer by about 7 to 10%. Or 2 to 3 drinks a day increases even further, close to 15% or so.